Welcome everyone to the 2018 Measures Under Consideration Pre-Rulemaking Open Forum Discussion number 1. My name is Kimberly Rawlings, and I will be kicking off this meeting and presenting along with Vince Brown from Battelle. Again, thank you for joining. This is our first of 2 open forums, the second of which will happen same time next week, and we'll have that reminder for you at the end of the presentation as well. Before we get started, I just want to go through a few housekeeping items so everyone knows how the call works. The meeting is moderated, so all lines are currently muted and will remain muted through the presentation itself, but then we'll be able to accept questions, live questions afterwards, and we'll make sure you know when we open the lines. But throughout the presentation, you can feel free to submit questions through the Q&A portion, or the Q&A feature of WebEx to make sure you get that question in so you don't forget it and we can make sure to answer it. The meeting is being recorded and will be uploaded to the CMS Pre-Rulemaking website for future viewing, and we'll make sure that the link for that recording gets out during a follow-up email for everyone. So what we're going to cover in today's presentation is a quick overview of the Meaningful Measures Initiative along with a quick review of the pre-rulemaking cycle and that timeline. If you called into the kickoff meeting earlier this week, this should be very familiar to you. We just want to make sure, given the importance of both of these items, that everyone's familiar, even if they aren't able to make all 4 sessions. But I promise we will try and make it very quick and brief for those of you that have heard it before. And we welcome questions on these topics as well. Then third, and really the bulk of the presentation, will be a live demonstration of JIRA given by Vince Brown. And then finally, like I said, we will open up the lines and take the questions submitted through WebEx and the Q&A feature to close the session, or close the presentation with a question and answers session. Let's go ahead and get started in talking about meaningful measures. So at CMS, of course, it's our top priority to put patients first, as patients are always at the center of our work. The 4 CMS strategic goals that are shown here on the slide support the patient and the overall patient experience. Those 4 goals are, first, improve the CMS customer experience. Second, usher in a new era of state flexibility and local leadership. Third, support innovative approaches to improve quality, accessibility, and affordability. And finally, but most importantly, empower patients and doctors to make decisions about their health care. And so in October of 2017, CMS announced the Patients Over Paperwork Initiative to reduce many burdensome regulations. And through that initiative, CMS has established an internal process to evaluate and streamline these regulations with the goal to reduce any and all unnecessary burden, try and increase efficiencies, and of course, ultimately improve the experience of the patient. And so in carrying out this internal process, our goal is to move the needle and remove regulatory obstacles that get in the way of the providers spending time with the patient and again, improve that overall patient experience. And so as a part of that, to help align our quality measurement work and our quality reporting work with Patients Over Paperwork, CMS collaborated with stakeholders to develop the Meaningful Measures Initiative. And what that is it's a comprehensive approach that really focuses us on core issues and measurement areas which are more patient-centric and that are really vital to providing high-quality care and improving patient outcomes. And so, again, this is a focused effort to try and align, to try and create some alignment and overall reduce the burden as we continue to have a focused effort on prioritization of our measures. While we have the framework, a part of that framework is the bullet list that you see on the screen as far as making sure that we are creating high impact or that we are addressing high impact measure areas that safeguard public health, that we're patient-centered, trying to focus more on outcomes and being outcome-based where possible. We also do have to make sure that we still fulfill the requirements of the program statute, but doing all of this while keeping the burden of providers in mind and trying to minimize that. And, of course, tapping into the overall goal of quality measurement of identifying significant opportunity for improvement, addressing measure needs for population-based payments or alternative payment models, and then where possible aligning across programs and or with other payers. So those principles and those guidelines are a part of this as well. And so at an extremely high level, the meaningful measure framework, and therefore the areas that I'm going to go over in just a moment, really work to achieve high-quality health care and meaningful outcomes to patients. And we have received a lot of feedback and talked to various experts and external stakeholders, some of which are listed here, as well as drawing on work from previous publications, stakeholders, et cetera, to do this work. So the Meaningful Measures Initiative created a framework displayed here. And we see the patient at the center of this, of course, where the patient belongs, and followed by, also in the center, the 4 CMS strategic goals. Around the center are 6 cross-cutting criteria that all measures should follow: reducing burden, eliminate disparities, track to measurable outcomes and impact, safeguard public health, achieve saving costs, and improve access for rural communities. Then depicted in the pictures around in the larger circle, as well as the bolded text on the side, we have our 6 healthcare priorities, which hopefully seem very familiar, followed by the 19 meaningful measure areas, which are depicted in those smaller bullet points. And so just to walk through an example quickly, here we have the healthcare priority of promote effective prevention and treatment of chronic disease. And so this priority contains 5 meaningful measure areas within it: preventative care, management of chronic conditions, prevention, treatment, and management of mental health, prevention and treatment of opioid and substance use disorders, and then finally, risk-adjusted mortality. And of course, there are many more measures that fall into these categories, but on the right-hand column under measures, you can see some examples of measures that fit into these meaningful measure areas and the programs associated with them. So that was a really quick run-through. Obviously, there's a lot more that one could unpack and learn here. So I encourage everyone, if you haven't already, to visit the Meaningful Measures website for more information, where we really, again, kind of outline each of the 19 meaningful measure areas, give an example, et cetera, so that you have more information. There's a recording of a longer presentation and just overall a lot of resources for your benefit. So now, just to do a quick overview of the pre-rulemaking cycle. So as many of you have known, I don't think that any of these have changed from last year, but just to note off the top of the presentation, measures that are currently in use do not need to go through the muck list again. They would remain in the programs per, the final rule. The only exception is that if the measure is being expanded or if the measure specifications are going through some sort of substantial change, those measures would need to go through the MUC list again. Last year, there were a lot of submissions for measures. Not all of them made it onto the MUC list. As with any year prior, if they were submitted in a prior year's MUC list but were not accepted, of course you are free to resubmit them in this current MUC list cycle. And then finally, kind of a little bit going back to the first point, we know that measure specifications change over time. So if your measure is in that situation where the measure has changed substantially, you may, and in some cases must, resubmit it again for consideration. So just a reminder of what happens. JIRA opened March 1st for all new candidate measures, so you can go into JIRA and start entering your measures now. We have 2 closing dates for JIRA this year, the first one being June 1st. JIRA closes for MIPS quality program measures June 1st, while for the rest of the measures, JIRA closes for all other programs, JIRA closes on June 15th. And it's very important to note that if you have a measure that you're submitting for MIPS as well as another program, you should enter that measure by June 1st to make sure that it's captured in the MIPS list. And Vince will go over as well the distinction between MIPS quality and MIPS cost, but in short, in JIRA this year, you will be asked whether you have a quality measure or a cost measure for MIPS, and it's the MIPS quality program measures that close June 1st. We pull the MUC list together and draft that for our internal review by July 20th. Then early in August, we'll have a federal-only stakeholders meeting to preview the MUC list and review it. And then a couple weeks after that, August 20th, the MUC list starts its clearance process. And that clearance process goes from the end of August until it's mandatorily or statutorily mandated to be published before December 1st. So a couple of new items for 2018. We do have the status of MAP refine and resubmit measures. Again, as I mentioned previously, MIPS cost and MIPS quality are separate programs. In JIRA, it's the same program, but we just had to spell it out differently in JIRA, so everyone will answer that question. And then going back to our overview of the meaningful measures, we will have everyone that is submitting a measure through JIRA, they will have to select one healthcare priority, so that's one of the 6. Again, they should look pretty familiar for you, but then the new one is that you will have to select a meaningful measure area, and those will have to be aligned. So the meaningful measure area, each meaningful measure area is associated with the healthcare priority, and so that partnership, that grouping, should be aligned. And then noting how finally how the measure will be reported. So with that, I am going to turn it over to Vince, who will talk about talk more in depth about JIRA.
Great. Thank you, Kim. This is Vince Brown from Battelle. We're the Measures Manager Contractor for CMS, and I'm glad to be here today and appreciate everyone's attention. I realize that the audience for this call may be in 2 parts, those who are well familiar with JIRA and the measures under consideration process, but wanted to listen in to see what's new for 2018. And there may also be folks on who have not worked with pre-rulemaking before, and but their sponsor or their supervisor says, hey, I need you to put some new measures in, find out how to do that. So we try to pitch this presentation so it will be meaningful to both of those groups. Just on the the 2018 interface, if you were involved in 2017 or prior, it will look quite similar to what you used before. Some of the choice lists in a scroll or drop-down type of item are quite long, so you'll notice to the right, and I'll show you these when we do the live on-screen demonstration. You want to use the scroll bar to see all your choices. Some of them have, if there is a drop-down, it will say Other. If the choice that you want is not shown, then you are able to choose Other. And the screen guidance will say if you do choose Other, then we ask you to scroll clear to the bottom of the form, and there's a place to add your comments field at the bottom. And so that's where you would add the actual information that was not on our drop-down list. That way the people at the MAP work groups and others at CMS who are reviewing these measures will have the most complete information available. Just a reminder, the title field is limited in character length. If you paste something in there that's longer than 255 characters, it will get truncated. These are things we learn from year to year. We ask you that the title contain only the title. There are other fields for identifying numbers. And we've found through the CMS and HHS clearance process that some reviewers do not like there to be abbreviations in the title. So we often have to loop back to the submitters and say, can we change your title to spell that out? So that may just save you some time. I know this is a very abbreviation-heavy type of field, so there's just a tip that might save us all some time. And likewise, a lot of the screen guidance will say, if you do not have the information that's asked and it is a required field, we would ask you to put NA in there. The way JIRA is set up, if it's a required field and you leave it empty, JIRA will not let you continue. It will stop and you cannot create that record. So NA is a convention that we use for something if you absolutely don't have and can't reasonably obtain the information. There is a feature in JIRA, we won't detail it today, but if you find yourself doing the same kind of searches for certain subsets of measures that have certain criteria, you are able to set up and save your own filters in JIRA to save you time from constructing which columns and which records within those columns you want to have appearing on your report. So that's a handy feature. We use it all the time. And I would also point out, because many people want to see all the measures of a certain type, you are able to export right out of JIRA into a CSV or comma-separated value file, and that is easily importable into Excel or other spreadsheets. So those are just some of the features that are handy in JIRA. So I just put this screen on here as we did on the kickoff call Tuesday to remind the new users of JIRA that you do need to get permission or access through the ONC JIRA, and then also there's a user guide on the pre-rulemaking website that details how to do this. But we ask you to contact MMS support by email and say which program you're working with at CMS, and then we take all the people who want to be added to JIRA and we vet that with a CMS program rep, just so they're aware of who their stakeholders are. So once you've been given access and you get your credentials, you should be able to log in just like I'm doing now, and then you can, it will remember your password if you want it to, and then you shouldn't have to worry about that anymore. Once you're in JIRA, you may need to navigate to the Projects menu at the top and select 2018 Measures under Consideration. That will take you to this landing page. I'm going to set it up just so you can see what it would look like. As of today, there are 2 records in JIRA. They both happen to be questions. We have no new measures, and we're hoping that the kickoff and open forum will encourage stakeholders to begin putting their measures in. So the main point of the demonstration today is to walk quickly through some of the features, especially the new features, and then to allow ample time for questions and answers. So to create a new measure, you go to the all-important yellow Create button here at the top. When I click that, a new box will pop up. It tells me that I'm on the correct project here. In Measure Submission, the green cross sign shows that I'm wanting to create a new measure. Here is where you would, under components, is where you would select which program you're wanting. I'll illustrate here. Here's where you can see, as Kim referred to, the MIPS quality program and the MIPS cost program. The reason we did this is brand new for 2018, and if you've been involved with MIPS before, chances are you're going to want to choose quality here. We believe the people who are entering cost measures under MIPS know who they are, and that most people will hear under MIPS choose the quality program. But you can scroll through here and pick whichever program or programs that you want, and that's how you populate that field. I will also point out, you see the red asterisk here right after the field label. The red asterisk indicates a required field, so those are the ones that you must complete with some information, or JIRA will not let you create your record or save your record. One of the new, there are really from 2017, there are very few new fields. I think only 2 or 3 are brand new. But what we have done is, in response to user feedback, updated a number of our screen guidance paragraphs. This is the text underneath each field. And so I'll walk through some of those. I wanted to show you this one. What is the history or background? Here's a new choice in this drop-down, and this will let you pick or tell CMS that your measure was previously submitted to a MAP. That is, it was on a MUC list before, but the MAP work group asked you to refine and resubmit it. So you can choose that for your history or background, and that will help the MAP work groups and others see that, this measure has been here before, but it has been refined and resubmitted. So that's a new choice. Under measure types, I will measure type field. I will point out, here's a hyperlink that's new this year. That takes you to the pre-rulemaking website, and there you can find a user guide that contains definitions of different measure types. We had a number of issues last year where folks were picking a measure type that did not really fit their measure. And so we're encouraging everyone to check the definitions in the user guide and classify their measures correctly. It just saves time. Kim mentioned that there is the priority field looks a little bit different than it did last year. It's called What One Healthcare Priority Applies, and that is a required field. Previously, you could select as many as you wanted, up to all 6, but this year, CMS is asking measure owners to choose one and only one priority that best fits their measure. Depending on which priority you choose, then your choices of meaningful measure in the very next field will change. So as Kim illustrated in her slide, here's the prevention and treatment priority, and these are the meaningful measures that go with that. So again, here you need to pick the very best one that most fits your candidate measure. I wanted to point out too, here's a new piece of screen guidance under evidence that the measure can be operationalized. For ECQMs, attach the feasibility scorecard or other quantitative evidence. So that's a new request this year. Some people would attach those in past years, but we found last year many of the ECQMs did not have this, and it's really important for it to move forward in the workflow. So we try to put this a type of reminder in several different places if you happen to be entering an ECQM. Here's one new question that Kim alluded to. Here's the old question we've always had: what data sources are used for this measure? But down below here it says, how is the measure expected to be reported to the program? That is a new field. There are only 4 choices there, and you can choose as many as apply to your measure. So that again is distinct from the data sources, and that's a new required field for 2018. Is this measure an ECQM? And what we see here is a new screen guidance under the if ECQM, enter the MAT number. Here's the new screen guidance. In the attachments field below, for all ECQMs, you must attach 3 things: the Bonnie test cases, the Value Set Authority Center attestation, and the feasibility scorecard. So I'll show you in a minute where the attachments belong. But if you're sending in an ECQM and it does not have those things, then CMS or I or some other person will contact you as the measure submitter and say, we need those for the measure to move forward. So just so for everyone's aware of that. One last item. Here, by the way, are links to past map reports. If you're interested, it just may save you some hunting and finding for measures that have gone to the map before, but maybe they underwent some changes. I'll scroll through here. Here's the comments field where you would fill in any information above where you selected other. This is where you would put it. You know, let's say the data source you have was not on our list. So what is the data source? Well, here's where you would say data source equals, and fill that in here in the comments box so that CMS can see that. Here's the attachments field. You can drop and drag files here, or you can also browse to attach files. There is a limit of 10 megabytes. If you need to upload more than 10, I would say contact CMS or MMS support, and we'll try to figure out a workaround on that. Those are all the new features this year that I could think of, and try to provide some highlights for those who are new to the pre-rulemaking or muck list process. Really, it's a lot like many other interfaces where you walk through the form and fill in the blanks as best you can. Obviously, the more information you provide, the easier it will be for CMS reviewers and also the MAP work groups to evaluate your measure quickly and make a competent and fair, decision when it comes to December, January. I wanted to point out also one feature of JIRA. It's kind of a limitation, and we get questions about it every year, so I'll just say it up front. JIRA does not let you stop in the middle of entering a new measure and save it and come back later. You have to have all your information together before you start for that measure. And when you get done, you'll push this create button. But if all the fields are not completed, if all the required fields are not completed, then JIRA will give you an error, and it will, excuse me, it will illustrate which fields you need to complete. And then once those are complete, you can click create. So what we've found, and has been very popular, is on the pre-rulemaking website, you can download a Word template that basically replicates this user interface in a Word file that you can open and save and edit. And that's where it's been helpful to many users to collect their information offline. Then when they come into JIRA, it's a matter of copy-paste into the various free text fields and drop-downs. I was saying on the kickoff call, we had one user who entered as many as 7 or 8 records in 1 hour last year. So that user must have had all the information very handy, because we do often get questions, how long will this take? And that, I think, is our speed record from last year, just as a point of interest. I can't think of any other highlights at this time, and I don't know if we've received any questions online.
Hey, Vince, we did get a question in from the computer. So the question's regarding data sources, and what is the difference between claims and administrative claims for data source? Can we have another question about the meaningful measure area? If you are tracking that down, we can hold on that question, or if you want to field the meaningful measure one, we can go with that. Yep, we just want to make sure that we're answering exactly correctly. So, yep, if we could take the meaningful measures question. Perfect. So the question came in, can one measure be listed in more than one meaningful measure area? Great question. No, we have to assign one meaningful measure area to each measure submission. So you want to just go with the one that most applies. You know, we definitely understand that there are some measures that will fall into several buckets, but we want to do the one that, again, most applies to that program and to that measure.
So, Kim, this is Vince. That brings up another question, and I think it's a follow-on to what was just asked. If one measure has two programs, those programs need to decide on which one meaningful measure goes with that, or does each program get its own meaningful measure? You see what I'm asking?
Yeah, so we do work hard and have been working hard to make sure that the measures in our programs, that the meaningful measure areas assigned to the measure align across the programs. So you really want to look at that measure and see which meaningful measure area best applies to that measure, and it should be the same across all programs. We don't want to have, you know, a measure, the same measure categorized in different programs under different meaningful measure areas. So it's really assigning the meaningful measure area at the measure level, and that should be consistent across all programs.
To that claims and administrative claims, I'm going to stick my neck out here and guess that this may be in the blueprint. I haven't studied that part of the blueprint, I'll confess, and maybe Mary or others on the call might know this, but I know that has a wealth of information on where measures come from and how they're developed, and that may be one place to check. That's a blueprint is published by CMS. It's available online.
Hi. So again, I just want to make sure that I'm answering the question, you know, with 100% with 100% accuracy and answering it, you know, to a depth that will make sense. I think what we can do is definitely follow up with the person that asked that question. Obviously, since I'm unable to just give you a quick answer, it's a really great question. You know, I mean, what I can say is that most cost and resource use measures use administrative claims data, so there's probably some distinction there, but unfortunately that. But like I said, I want to give you a clear answer that I'm 100% comfortable with. So we will definitely follow up with you on that, and I apologize that I can't give you a quick answer at this moment. Did we have any other questions?
How can you get notified if there's discussion about a certain measure through JIRA? The user finds themselves going in JIRA checking constantly.
Yes, this is Vince. It seems like, let me see if I can, I'm just looking in my JIRA real quick here. There's a way to become the watcher of a measure. Because I'm commenting on measures all the time, I get notified whenever anyone changes or comments on a measure. That's automatic in JIRA. Once you've commented on it or wherever you are in the workflow, you get automatic notifications. Let me see if I can look this up. I don't know the exact procedure to how you add yourself as a watcher, but I'll look that up, and again, we'll put that out in our Q&A somehow. Because I know I'm seeing a button right now that says stop watching this issue. So that tells me there's a way that you can make yourself into a watcher for a given measure record. Hope that's responsive.
Thank you, Vince. And at this time, there's no other questions in the queue. If there's anyone with a final question that you'd like to take over the phone, we'll take one last request for questions. So just a reminder that we do have the needs and priorities session that will be on April 10th from 1 to 3 p.m. Eastern time. So that will be with the program leads kind of going through each program and what those needs and priorities are for the coming year. And then we'll have another open forum session on April 12th from 1 to 2 p.m. Similar setup where we'll review, again, high-level meaningful measure information and walk through the JIRA demo. The questions may be different depending on that audience. And then again, as with all materials on the pre-rulemaking website, you can access that for previous webinars that have been offered, for a lot of the tools and user guides and things like that to help in the rulemaking submission process. All of that is available on the website. This will be your contact information. If you have questions specific to the CMS side of things, Helen Dollar-Maples and Kimberly Rawlings will be your points of contact, and certainly you can email Vince Brown here at Battelle. And he mentioned earlier the mmssupport@battelle.org email address. You can reach out with generic questions, and we can make sure that gets sent to the right person. Vince, correct me if I'm wrong, but these slides will be available on the pre-rulemaking website within a week or two. Is that right?
Yes, CMS usually does publish these in a PDF format for later review, and then as Kim said, also the sessions are being recorded for on-demand video viewing. Those will be available a little bit later, but they'll be linked from the pre-rulemaking website. So if you know of anyone who was not able to join the call today or next Thursday's open forum, then you or they may check that pre-rulemaking website for the downloadable videos.
Okay, great. Thank you so much, Vince. And thank you, Kim. And thank you, everyone, for joining today. That concludes our open forum. Don't forget to join us on April 10th for the Needs and Priorities session at 1 o'clock Eastern Time. Have a good afternoon.